It's Adam here. So today's video is entitled "Should We Demonize Medication for Mental Health?" and it's quite a loaded title. Quick disclaimer: this isn't a medical advice video. Certainly, do not use it as a means of diagnosing yourself in any way. But I see this discussion happening a great deal, and maybe it's because I work in a professional field that many alternative therapists also work in or are a part of, and many of whom reject conventional medical approaches, in particular medication, and you know that's the reason that perhaps they've been motivated or inspired to go and seek out alternative means. Now, psychology and its fringes, psychology today is one of the professions that is developing really fast, and there's a couple of main reasons that I'll cite today. One of them is that the more we know about human psychology, the human brain, the more eloquent our theories and our methods become, our approaches become, and also is this fast-changing environment of today that's really having a substantial effect on most people. As a result, the number of patients in this field of medicine has jumped in recent years, and add to that the effect of the pandemic that we've all recently lived through and are living through. 1 in 8 adults, that's just over 12%, are actively attending therapy, and over 10% take medication in the US. Figures are similar in the UK, but I can't get absolutely official figures to confirm that wholly. Now, judging by those numbers, it's easy to understand why it's important to perhaps be informed about the use of medicine and medication, as well as the pros and cons to taking it, you know. The pros, you know, with regards to chronic and more severe illnesses, medications can be extremely useful. Both in the long term and the short term. You know, medication has some real treatment advantages, such as a faster rate of symptom remission and a greater effectiveness in treating the vegetative symptoms of depression, for example, but also, you know, things like sleep and appetite disturbances. To make the disease easier to deal with in a more consistent way as well, given that the patient follows the exact prescription and the recommendations of their doctor or the prescribing psychiatrist, for example. The effects that people notice within just a few weeks are overwhelmingly positive, typically. It should also be mentioned that in extreme moments, such as psychotic episodes and mania, medicine is sometimes pretty much the only thing that can help. Also, diseases that are chronic are known to have, or many diseases that are chronic are known to have a deteriorating effect on the brain itself, and medicine can help prevent this. The main illness that we know, or illnesses that we know medication has an overall, you know, positive effect, typically tend to be those that have part of their root in biology. So, for example, schizophrenia, chronic depression, as well as, you know, sometimes bipolar and some anxiety disorders. You know, if you follow my work, you know that I don't wholly prescribe to and there's not really much of a case for a complete genetic predisposition for mental illness, and we tend to look at a biopsychosocial model of contributing factors rather than just purely biology. But where there is some root in biology, medication has been found to be to often be even more effective. Now, not only do medications help in stopping the deterioration of the brain, they can also increase its overall function on occasion. Now, the range of things that medication can help with it is broad. It can help with mood swings, with psychotic episodes. Overall treatment can have a profound effect. It can have a calming and focusing effect, and it can sometimes help with the therapy that a patient is receiving or should receive. Now, these are only part of the potential uses of medication. When it comes to certain illnesses, they're also known to have a positive effect in much more mild conditions when taking the way that they've been prescribed. For example, treating anxiety disorder often comes with taking SSRIs. I'm sure you'll be aware that's selective serotonin reuptake inhibitors, which should be used very carefully, but can have a positive effect if the prescription is followed. One of the things that you probably see, I sort of wince a little bit when I'm referring to illnesses, because sometimes just the term illness does tend to pathologize mental health issues, and not all of them warrant full-blown pathologization. But I'll talk about that in a little bit. Now, medication also has some disadvantages. There are some cons as well as the pros. In particular, it reinforces, medication can reinforce client passivity. And this is a most detrimental cornerstone of depression, for example. But also, there are issues around uncertain dosing and effectiveness, potentially negative side effects. There is habituation, or and what's referred to as poop out, where the drug may eventually stop working, and higher initial rates of relapse as well. Now, one of the worrying aspects of medications as well is addiction. Becoming dependent upon that drug. Fighting fire with fire is a term that sort of fits as far as some of that is concerned. Getting addicted to most psychotropic medications is easier than some people might assume or be aware of, and it's mainly because they directly influence the brain. Withdrawal is also a concern, mainly because it seems like the illness is returning. Certainly in when I've worked with people that have taken it upon themselves, against my advice and against their doctor's advice, to throw their medication away, the withdrawal that's occurred has sometimes led them, into a vicious cycle, where the people need to be weaned off effectively and thoroughly in a robust, well-considered fashion, because the disruption to the body sometimes can lead to more challenges. There's also the ongoing debate on how some medications affect the brain long term, and whether or not they should just be used in extreme situations rather than on a sort of habituated day-to-day basis, for example, for really long term. I've worked with clients that have been taking something like Prozac, fluoxetine for years. Now, side effects are common in a range of these drugs as well, ranging from drowsiness, weight gain, to insomnia, lack of libido, sometimes even hallucinations in some of the more extreme drugs. But overall, taking medications for mental health, it's a serious subject, and it's not without some small amount of risk that perhaps you would discuss with your doctor or the prescribing psychiatrist, for example. A lot of people are opposed to taking medications for their mental health, and that can turn into a problem, especially if medication is necessary. One other area of discussion that I mentioned earlier is that of client passivity, and that can be increased when mental health is pathologized, for example. That is, when someone believes that their mental health issue is an illness or a disease, they can feel afflicted, and therefore medication becomes a choice that can actually reinforce the pathologization. You know, not all mental health issues are such pathologized illnesses, and part of the aims of many approaches to therapy is actually to help depathologize. Certainly with modern hypnotherapy that I teach and lecture on, we seek to depathologize illness and make people feel capable of overcoming aspects of it, if not the entire thing, for themselves. And that's difficult when the belief system is entrenched in a kind of medical model or a medicated model that I've discussed here. However, one should always be aware, you know, that there are negative effects, but there are positive effects, both long and short term. Taking medications for mental health, you know, I said earlier, it's not an exact science, and sometimes dosage may require some tweaking, and some doctors or psychiatrists may need to switch from one medication to find one that's better for that particular individual that they're working with. There's plenty of science out there that's shown placebo to work, you know, just as effectively, or on occasion even more effectively, than some antidepressants, for example. And this has also, you know, certainly led to a lot of discussion about the efficacy of medication for depression, as well as other issues. And I think that the science of placebo, you know, it's a definitely a video for another day, and it's a course. And many argue that the effects that are derived from some medications, and the fact that they're being prescribed by a doctor or a psychiatrist, for example, are derived, you know, some of those benefits are derived from placebo mechanisms, for example. I don't think we should be demonizing medication, though. It's probably quite irresponsible to outright demonize it, especially if you're in a therapeutic profession. You know, that there are multiple occasions in which medications are really useful and necessary. Other occasions, perhaps less so. I think, importantly, we recognize that it's not our sphere of professional competence, as far as, you know, psychotherapists and hypnotherapists are concerned. You know, unless you're qualified to prescribe medicine, you shouldn't be giving advice as far as that's concerned. And you know, you should be yielding to the professional medical advice that you're being given, or that one of your clients is being given. Heck, that's it for this video. It's one of those topics that's been very popular in a couple of groups that I belong to. But that's all for now. Do subscribe to this channel. Go visit my college to explore a range of live and online courses on the subjects of hypnosis, self-hypnosis, hypnotherapy. I send you my very best wishes. Goodbye for now.